Do you have shoulder pain that just won't quit no matter how much you stretch it or rest it? Let's talk about why that happens and what you can finally do that actually works. I'm Dr. Dominic Rangel. I'm a physical therapist in San Antonio. I help first responders, busy parents, and active adults recover fast, stay strong, and stay ready for whatever life or their job throws at them. Here's the deal. Shoulder pain that lingers is usually not just a muscle strain. It's often a stability problem. Your shoulder blade and your rotator cuff aren't working together. That's why resting or basic stretching doesn't solve it. But what does work is strengthening the right stabilizers, improving your scapular control, addressing posture, especially for my firefighters, cops, and folks in heavy gear or at a desk all day. These are the big things that I recommend for these patients. This is where you can start today. The crossball smashing on the back of your shoulder, where you can work out those sticky areas that limit your motion. My favorite brand is in the link in the description. You got to utilize exercises like wall slides that train your shoulder to move the right way again and add a lift off for a lower trapezius activation into that exercise. You got to start strengthening your muscles. So like side lying external rotation with a dumbbell or a band is my favorite type of exercise. We start off with really low weights in order to be able to tolerate the amount of load that you're having put through your arm, and then increasing that over time in a linear fashion, starting with maybe like ones, twos, threes, fives, tens, etc. The adjustable dumbbells that I use in the clinic are linked in the description, and those are the ones that I personally use for me and for patients as well. Other types of equipment that you might need are going to be things like mini bands. So do things like warm-ups for your shoulder and you get activation for your shoulder. I linked both the TheraBand as well as other bands that I use that have varying resistances. The ones with the varying resistance are the ones that I actually use in the clinic because they have a handle and I like to be able to progress them over I don't want to recommend anything that I haven't personally tried. So these are the ones that I actually used before. When we do things and we work together, I assess your shoulder blade strength, your rotator cuff balance, and your posture. We track objective progress. Yes, I use a handheld dynamometer to test strength so we know exactly what's changing. We build a plan that fits your work demands, whether that's chasing kids, chasing suspects, or staying at your desk on the job. If you're tired of the pain sign, you got to stop guessing. Let's fix it. If you need to contact me, my contact info is in the description. You can call, you can text me at 210-390-6577.